Hi, welcome to AMSA Utah. In conjunction with AMSA Community Service, we will be uploading a series of videos related to eating disorders, and today would be on anorexia nervosa. Please subscribe to our channel and turn on the notifications so you won't miss out on any of our upcoming videos. As we all know, anorexia nervosa is an eating disorder characterized by self-starvation and intense fear of gaining weight. People with anorexia usually have abnormally low body weight, a distorted perception of weight, and use extreme efforts to control their weight and body shape. They may purge out the food they eat and even set a limit to the calorie intake by counting for each food consumed. Moreover, they exercise compulsively to avoid gaining weight. No matter how much weight is lost, the person continues to fear weight gain. Anorexia most commonly affects adolescents and young adult women, although it also occurs in men and increasing in children and older adults. The exact cause of anorexia is idiopathic, but probably due to a combination of biological, psychological, and environmental factors. One of the most prominent causes is the biological factor. Although it's not clear which genes are involved, there may be genetic changes that increase an individual's risk of developing anorexia. People with a first-degree relative with such an eating disorder are more prone to developing eating disorders. Psychological factors also play a role in the development of anorexia nervosa. Anorexia acts as a mechanism for people to cope with extreme stress, abuse, and painful emotions by controlling their food. Feelings of low self-esteem, anxiety, anger, loneliness, and inadequacy often contribute to the development of eating disorders. People with obsessive-compulsive personality traits tend to stick to strict diets and food despite hunger. They may have an extreme drive for perfectionism, which makes them think that they are never thin enough. Last but not least, the environmental element contributes to the development of anorexia nervosa. In today's modernized world, the idea of beauty revolves around being thin, and this places a huge amount of pressure on people, especially the younger generation. Success and worth are often equated with being thin, and peer pressure may help fuel the desire to be thin, particularly among young women. Now, let's talk about the risk factors of anorexia nervosa, which includes dieting and starvation. Dieting is a risk factor for developing an eating disorder. There is strong evidence that most of the symptoms of anorexia are manifestation of starvation. Starvation affects the brain and influences mood changes, rigidity in thinking, anxiety, and reduction in appetite. Starvation and weight loss may change the way the brain works in vulnerable individuals, which may perpetuate restrictive eating behaviors and make it difficult to return to normal eating habits. Lastly, transitions where whether it's a new school, home, or job, or even a relationship and breakup can bring emotional stress and increase the risk of anorexia. So, what are the signs and symptoms of anorexia? First, let's take a look at the physical ones. This may include extreme weight loss or not making expected developmental weight gains. Besides that, one may experience a thin appearance, abnormal blood counts, fatigue, and insomnia. In addition, dizziness or fainting, bluish discoloration of the fingers, hair that thins, breaks, or falls out, or even soft, downy hair covering the body also might be experienced by a person confronting anorexia nervosa. Not forgetting, the absence of menstruation in women and teenage girls are the main indication of this disorder. Emotional signs and symptoms may be present as well. People with anorexia can be very self-critical. They might withdraw from social situations and often feel the need to be in control. They might feel irritable and/or depressed and even experience thoughts of self-harm or suicide. After all this, you might be wondering, what are some of the treatments for anorexia nervosa? Number 1, we have psychotherapy. Psychotherapy is a counseling that focuses on changing the thinking and behavior of a person with anorexia nervosa. There are a few types of psychotherapy that can be implemented, including acceptance and commitment therapy, which motivates the patients to change their actions instead of their thoughts. We also have cognitive behavioral therapy, which guides patients to address their distorted thoughts and actions and replace them with more optimistic actions. Next, we have cognitive remedial therapy, which trains patients to improve cognitive abilities and social functioning. Dialectical behavior therapy, which helps patients manage their emotions, tolerate stress, and improve relationships. Family-based therapy, which puts the family in charge of providing the appropriate nutrition for the patient. Number 2, medication. Healthcare providers may prescribe medication to help manage anxiety and depression, reduce the risk of relapse after completing treatment, and help with menstrual regulation as well as in gaining weight. Number 3, nutrition counseling. This talk-in therapy helps to guide a patient on how to restore normal eating habits, as well as the importance of having a balanced diet. Number 4, hospitalization. Hospitalization is necessary for anorexic patients with serious malnutrition, mental or physical health complications. While there are no clear measures that can be taken to prevent anorexia, there are certain ways that may minimize the risk of developing severe anorexia nervosa. Recognize early signs and symptoms of anorexia to avoid the development of complications of anorexia. If you notice a friend or family member is struggling from dissatisfaction of his or her appearance or suffering from anxiety and low self-esteem, consider addressing these issues with them and listen to their needs. It may also be helpful if family and friends follow a healthy lifestyle. Lastly, and most importantly, let them know that personality matters way more than looks, and that they are not expected to be perfect because perfection does not exist. That's all for today's video. Thank you so much for watching. If you found this video helpful, please hit the like button and share it. Also, don't forget to subscribe and turn on the notifications for more informative videos. See you in the next video. Till then, stay safe and take care. Bye!